Assalamu alaikum, dear students. This is the last as well as the fourth session on the teaching strategies. Before this lecture, we discussed the different strategies regarding at the classroom level, जिसमें मुख्तलिफ जैसे ब्रेनस्टॉर्मिंग था, जैसे उसमें प्रेजेंटेशन था, जिसमें मुख्तलिफ जो है ऐसे हमने डिस्कस की उसके एडवांटेज डिसएडवांटेजेस और एज वेल उसकी जो सजेशन थी। इस सेशन में हम जो स्ट्रेटजीज डिस्कस कर रहे हैं ये क्लिनिकल सेटअप रिलेटेड है कि जब आप जो है एज अ क्लासरूम से बाहर या किसी क्लिनिकल एज अ क्लिनिकल इंस्ट्रक्टर हैं या आप जो है किसी भी वार्ड में आप इंचार्ज है या वहाँ पर आप टीएमओ है और वहाँ के स्टूडेंट्स आ जाते हैं, वहाँ पर आगे स्टूडेंट को आप कुछ इस तरह डायरेक्टली जो है उनके साथ आप कुछ इंस्ट्रक्शन देते हैं, कुछ इस तरह के इंस्ट्रक्टर के तौर पर आप असाइन हैं, तो फिर हमारी स्ट्रेटजी क्या होगी या किस तरह जो है हम पेशेंट टू पेशेंट जो है उनसे इनकी गाइडेंस कर सकते हैं, उनकी रहनुमाई कर सकते हैं, किस तरह हम किसी भी टॉपिक जो है अमूमन जो है हमारे साइकोमोटर डोमेन के होते हैं, मोस्टली दे जो क्लिनिकल हायर लेवल पर होते हैं वो इसी जो क्लिनिकल सेटअप जो है उस पर डिस्कस की जाती है। इन स्ट्रेटजीज में मेथोडोलॉजीज में जो क्लिनिकल सेटिंग में एज अ इंस्ट्रक्टर एज अ टीचर जो है एज अ क्लिनिकल इंस्ट्रक्टर हम अपने स्टूडेंट्स के साथ उसको इंस्ट्रक्ट कर सकते हैं, उसको टीच कर सकते हैं। So there are basically four methods through which we can guide and teach our students. There may be others in the list, but these are the most commonly used in the clinical setup in the hospital or in any other which is not classroom but any clinical setup. That is the direct patient contact, one-to-one precepting, role modeling, and then the standardized patient. So let's discuss one by one. So the first one which we are going to discuss, this is the direct patient contact. और इससे ये होता है कि आप जब पेशेंट वो जो डिफरेंट वार्ड में पेशेंट होते हैं तो उनसे आप हिस्ट्री लेते हैं, उनसे आप जो है उनकी डिफरेंशियल डायग्नोसिस या उनके डिफरेंट जो फिजिकल असेसमेंट है या और इस तरह उनकी जो मैनेजमेंट रिलेटेड जो है आप उनसे बातें करते हैं और उनसे आप उनकी केयर करते हैं। तो इसमें यह आ जाता है कि व्हेन यू आर फेसिंग द रियल पेशेंट, यानी स्टूडेंट्स दे आर ऑब्जर्विंग and you are dealing with the patient, you are caring of the patient and you are talking with them, it means you are the patient, you are dealing with the real patient. So इसको पे जो है we can say that it is a direct patient contact strategy. So practicing patient care and communication skills along with clinical problem solving through the direct contact with the patient, and this is one of the most effective लेकिन इसके लिए कुछ रिक्वायरमेंट ये है कि जो ऑब्जर्वर है, जो स्टूडेंट्स हैं, जो लर्नर्स हैं, उनके पास पहले से कुछ ऐसी नॉलेज होनी चाहिए कि वो जिस पेशेंट को देख रहे हैं तो उसकी जो लो लेवल थिंकिंग है या जो लो लेवल कॉग्निटिव डोमेन है, जैसे नॉलेज है, मेमोराइजेशन है, कम से कम इसको ये उसका पता हो कि डिजीज क्या है, डिजीज के टाइप्स क्या है, इसकी काजेस क्या है, मैकेनिज्म क्या है, फिजियोलॉजी क्या है, यानी दे हैव सम कॉग्निटिव नॉलेज, दे हैव सम कॉग्निटिव लेवल पे उसकी कुछ ना कुछ जो है डेवलपमेंट ऑलरेडी हो चुकी होती है, तब जाके जो है ये इफेक्टिव है। अगर कुछ स्टूडेंट जो हैं या लर्नर्स if they are facing such patient such disease such disorder जिनका इनको पहले से कोई पता नहीं है, they don't know, they are not prepared, तो फिर ये या तो एक्स्ट्रा काम करना पड़ेगा इस टीचर को या जो है उसको स्किप करेगा, सो देयर विल मे नॉट बी एन इफेक्टिव स्ट्रेटजी देन। सो ये है कि ये डायरेक्ट पेशेंट केयर जो है ये हायर लेवल पर होता है व्हेन द स्टूडेंट्स जो हैं ये काफ़ी जो लो लेवल या जो बेसिक साइंसेस उसको पढ़ के आए होते हैं। और सेकंड ये है कि चूंकि इसमें they should be encouraged to touch the patient, to communicate with the patient, लेकिन उनमें इतनी कॉन्फिडेंस और साथ साथ उनकी इतनी प्रैक्टिस नॉलेज होनी चाहिए जो हमने पिछली जो क्लासरूम लेवल पर डिस्कस किया था, जिस उसमें डेमोन्स्ट्रेशन था या रोल प्ले था, तो ये वो स्ट्रेटेजीज है जो उन लर्नर्स को इस लेवल के लिए बनाते हैं कि व्हेन दे आर फेसिंग द रियल पेशेंट, सो देयर विल बी नो प्रॉब्लम फॉर देम। सो उनको पहले जो है इस तरह की ट्रेनिंग एक कंट्रोल एनवायरनमेंट में देनी चाहिए, तब जाके उनको हॉस्पिटल विजिट इस तरह की करनी चाहिए, या वार्ड में उनको विजिट करना चाहिए, या वार्ड में उनको क्लासेस लेनी चाहिए। सो कुछ एडवांटेजेस जो है, ऑब्वियसली व्हेन इट इज आप डायरेक्टली पेशेंट से कांटेक्ट करते हैं, डायरेक्टली पेशेंट से कम्युनिकेशन करते हैं रियल पेशेंट से, तो ये एक अच्छा एक एनवायरनमेंट दे रहता है लर्निंग के लिए, which may not be provided that by the dummy patient, by the role model, or just by the acting like a model, acting like a patient in the classroom. तो ये वो जो है रियल लाइफ कॉन्फिडेंस दे रहता है, रियल लाइफ एक्सपीरियंस दे रहते हैं, वो कंटेक्स्ट दे रहता है, which may not be provided in the classroom level. Similarly, this strategy they can provide the student with a lot of hands-on experience, because as they were dealing with the real patient, so they will have a lot of experience, practical experience. They can provide the continuous feedback. Continuous feedback mean they will just dealing with the patient who are in the ward, who are in the rooms, in the private rooms, and they will visit them. So there will be a series of feedback, okay, and that series will be with specific rhythm, specific time जो है कि बात दोबारा again and again होती है, and that actually known as the continuous feedback. So chunki, even if it is hospital based or ward based, then there is a series of the continuous feedback from the patient towards the learners. Similarly, through this direct patient contact strategy, the approach of the student and the teacher, there can be an individual basis. I mean, when a teacher, when an observer that is observing another teacher, another instructor, another senior, and who is just talking and communicating with the patient. So that may be an individual basis as well. Similarly, overall, this strategy, they can enhance the communication skills of the learners, that can enhance their problem solving skill, their clinical decision making, as they will see the real patient. So in the next time, they will be much more confident while facing such patient, while dealing with such patient. Though they may have such problems when they are facing for the first time such patient. So that's why observation is must, and their keen observation is necessary, and as well as the required knowledge is necessary for an effective way of learning through this strategy. There are some disadvantages which may endanger the strategy as an ineffective way, and that is, this strategy may not include experience with all kinds identified in the objectives as the patient depend on the type of patient. So it might be, there may be some objectives which may be listed in the curriculum, but they may be not present. They may be not present in those patients who the learners and the students are facing and dealing with the teacher. So some objectives, they may be skipped, they may just left undiscussed, untaught, is because they depend on the patient. They might have those उनको जो patient जो requirement है उसके लिए वो available नहीं है. Unlike the classroom, because वहाँ पर जो role model होता है, जो demonstration होती हैं, जो cool environment होता है, वहाँ पर objective के मुताबिक ही सब कुछ करना पड़ता है, और यहाँ पर जो है that is, so it means there may be complete matching to with all the objectives, and might be there may be some objectives which can be taught, which may be left untaught. Similarly, this strategy that required direct observation by faculty for the optimal use, which may create some burden for the teachers. Similarly, as we discussed previously in the previous slide, this strategy that required the preparation as well as the training of both the teacher and student. The preceptor, that means the instructor, the teacher who is starting the students. So it means this strategy, if there is preparation and training which is required for the dealing with such patient, then it's okay, that's maybe very effective. But on the other hand, if there is no such preparation and training, and if the teachers, they may not have such clinical experience, and he is not a good clinician, he don't know the basic of the dealing of the patient and treatment of the patient, so they may give some wrong message to the students. And if the students are not prepared, so might be they will not clearly understand what is going on there. So if they have well prepared what that in which domain, in which wards we are going, they should need to have some basic information, some basic assessment tools. Suppose they are visiting the neuro ward, so they should have some basic assessment of the neurological conditions. They should have some knowledge of the common neurological disorders. They should have some knowledge of the signs and symptoms, the causes, and the physiology of the common neurological disorders like the spinal cord injury, like the multiple sclerosis, like Parkinson's disease or stroke. So if they have prior knowledge, and as well as the trainer, the preceptor, that is quite trained in dealing with such patient, so this may be one of the best and more effective strategy for learning to the students. Relies heavily on the skills of the preceptor, as we discussed. If he is a good clinician, so the students will be much satisfied. And that's why clinical instructors who are going to teach the patient and the real, teach the students and the real patient, they must have proper training, they must have higher qualification, they must have quite experience of dealing with the real patient. So they're avoiding such wrong message or the misconception. To ensure the learners they are prepared for the time spent on their own with patient have the previous knowledge and basic skill, and that maybe when they are going to visit the hospital, when they are going to attend the patient in the wards in the hospital in the real situation, so they should be taught in the classroom through by dummy patient, by dummy model, by role modeling, by role play, by demonstration. Just like we are the students are studying, and the doctor is the teacher is describing some case study, and then if they face the same case study in the hospital, so there will be no problem. They will be already familiar with such case and such problem, such patient. So it means if we want to have this as a successful and a very effective strategy for our student, so we should have preparation for what we were doing, as well as the students should have some knowledge, basic knowledge about the assessment, signs, symptoms, etiology, and all about those common disorders of that specific domain. Similarly, integrate patient interactions with the educational process as what we are teaching, what are the objectives. So these, if we meet with what we are going to teach and what are in the objective, if there is integration between these two, then I think that will be a very effective way. And train the preceptor, there is different lines courses for the clinical instructors, like we can say that this is the clinical teaching free webinar. So there may not be enough for the proper training, but something is better than nothing. So they should have experience, as well as they should be trained that how to clinically instruct the patient, how to students, how to clinically deal with the patient when they are teaching to their students. Usually the senior faculty should be assigned for such tasks, as they have a lot of experience while doing all these activities. So they have that proper knowledge, they have that required experience. So it will give also an opportunity not only for the learners and students, but as well as for the juniors, doctor, the junior staff as well, when the teacher, the higher, the professor that's teaching those students in that hospital or ward. This is another one-to-one precepting. This is mean the one-to-one discussion between the student and the teacher. That is specifically very useful and very effective for such students who are weak at some specific perspective, at some specific point of view. तो दिन जो है टीचर जो है इनसे मीट कर सकते हैं, इनसे जो है वो बात कर सकते हैं, डिस्कस कर सकते हैं और इनसे जो है उस पर बात कर सकते हैं. या स्टूडेंट को कोई क्वेश्चन है, इंडिविजुअल कोई प्रॉब्लम आ गई है, सो दे which may be the patient related, so which may be in the hospital during their visit. So जो है the student they can ask from, and then they can discuss the case with each other. And such strategy, there should have a proper senior teacher, as we discussed previously, to have all the questions very clear. So instruction is provided by direct personal interaction between the teacher and learner, and these interaction between the teacher and student, they may involve sharing of different information regarding the query and regarding the question of the student, demonstrating just to make it clear to the student. The questioning, again, just to have some feedback, we're having some knowledge that what is the level and what he think about that problem. The problem solving, the directing those work, the providing feedback, and there may be a positive feedback as well as the constructive feedback to the student. And then the observing and assessing learner performance. So all these will have a proper impact and a good positive impact on the student, especially those who are weak at specific aspects of the clinical domain. A medical education case presentation is often a part of this process. What this side round involves a similar process involving a group of learners up in a different level in the inpatient setting. And यहाँ पे जो है one-to-one में जो learner है, there may be 2 or 3. It means there will have a very small number of people. So what presentation जो है, there might be in this one-to-one precepting, and that may be in the direct patient contact as well. What are the advantages of the one-to-one teaching and one-to-one instruction? One is there is only one student and he should be actively involved in the discussion. He will answer the question. He may ask some question from the learner. He will observe there is active involvement of the student in this strategy, as it will have only one-to-one, or there are 2 or 3 numbers of student in this strategy. And this strategy that also allows for individual approach tailored to specific need of the learner, as we discussed previously, that some specific aspects student may be weak there, that may be at some component of the management, like that maybe how we can assist such patient, or if the patient have that problems, then what we will do. If there is a comorbidity, so what will be our next option. So such question that should be asked in a particularly in a single way to the teachers, and then they can teach them. So this is one-to-one precepting, one-to-one teaching. Provide opportunity for the role modeling, demonstration, observation of appropriate professional habits and attitude, because that will have a proper time between the student and the teacher. Similarly, this strategy also provides practice to build skill, and as well as to solve the problem in real situation with expert supervision, guidance, and the opportunity for the continuous feedback. This one-to-one teaching, this is much similar and familiar with the previous one, direct patient contact. But in the direct patient contact, the presence of the patient is necessary. Here in this one-to-one teaching, there may be patient and there may not be patient. This is not mandatory that the patient may be present in this strategy. But if the patient is there, so there may be a demonstration, as we discussed previously. But all these one-to-one teaching are teaching to a 2-3 number of students that will build up the skills in those students, and as well as they will enhance their problem solving skills. Similarly, they will also provide some that sense of cooperation and teamwork as well. They will enhance that teamwork strategy, as there will be 2 or 3. Usually such students which are very familiar with each other, they ask the same question, or when one have the problem, the other 2 accompany them. So they will also have that sense of the teamwork and the cooperation with each other. Similarly, this strategy, they promote the development of the verbal communication skills, as there is direct conversation between the teacher and the students. So obviously, this strategy will also help in the enhancement of their verbal communication skills of the students. There are some disadvantages, and among them, that is maybe very time consuming Because if the number of students, there may be this one-to-one teaching, there may be followed up to the direct patient and contact strategy. There is a class on the real patient, and the professor, the teacher, the instructor, they have a class on the real patient to the student. Then one of the two of the total group of those students, they again ask some question, and then the teacher again explaining. So that may be time consuming. Similarly, there may be personality conflicts as well. Personality conflicts mean when two, 3 person or more than them, when they come with a disagreement over a statement, and this actually known as, which may lead to their some appearance of their characteristic of their personality. So that simple mean they have some disagreement over a statement, and both may be right on their own, but they will be think in different aspects. So this strategy, they may appear, they may create such personality conflicts between the student as well as the teacher and the students. As the teacher will explain them one thing, but they will not go not in their situation to understand, or they will think in other aspects, so they will think on the other level or in the other way, and that's why they may create some personality conflicts. Similarly, that one-to-one or this strategy, that is totally a burden on the teacher, and that depend on the teacher. That is a huge responsibility, as the teacher, the student are asking something. It means they know nothing. They have some feel. They have no knowledge. They have some misunderstanding about the condition. So that's why now this is the responsibility of the teacher to clear the query, to help and to clear the concept of the students. So that's why it relies heavily on the teacher being a good role model and have effective teaching, questioning, and feedbacks. Because if these characteristics they are not present in the teacher, then might be this strategy they not have that effective way which it should be. So how we can have this a very effective strategy, that is the teachers should yes, this is familiar, and this is somehow similar to the direct patient contact. So much of the suggestion, much of the advantages, they are much of the characteristic of these strategies, they are similar to each other. So they should get training. The teachers should have some proper training that how to clinically teach the students at the regular hospital visits, or in the ward visit, or in the clinical setup. Or these instructors, these teachers, there should be a higher level classification. There should be HHV or other professor or the full professor in order to have that, because they have a lot of experience while teaching these students. And there is need of that constructive feedback. Constructive feedback mean there is a positive criticism. It means you have to discuss some weak points, but also you are giving the solution to those, how they can deal up with these points, how they can cover up, overcome on these weaknesses. So this is actually the constructive feedback. Orient learners and make behavioral and learning expectation and objective very clear, as it is the very common to all the strategies that we should teach, and we should follow the curriculum objectives. Demonstrate and role model what you are teaching, as obviously this is the both necessary mandatory for both the direct one or teach direct patient contact and the one-to-one, in which you have to demonstrate all the maneuvers and all the skills. Identify the level of the learning, and then after you have to, if the students that don't have that basic knowledge about, so you have to start from introduction of the disorders. And that's why these strategies, they are best for the students who are in their final years or in the second last years, because they will have some knowledge about these systems, about the disease, about their assessment and all extra, etc. And not only that is the responsibility of the teacher to identify the level of the learner, they have to assess their students, that what are their needs, in which aspect they are weak, and then how to approach and how to treat and how to tailor those how to strengthen those weaknesses of their students. If the teacher is able to do that, so that may be a very effective strategy. Take advantage of the teachable moment. Teachable moment means there's a specific that time at which it is very easy for the learner to learn something. It means there is a specific time for every learning, and this concept was presented in the 1950s. That for every learning there is a time, and that specific moment in which it's much easier and convenient for the learner to learn that specific task is actually known as the teachable moment. We can also have some open-ended question, and these open-ended question will let the students to share their information, share their thinking, which might reveal their level and reveal their pre-existing knowledge. So we should ask some open-ended question, and open-ended question, they will have a lot of variety of answers. And these open answers to this open-ended question will let the teacher know to the level of the students, the pre-existing knowledge and the memorization of what they know early in advance to their discussion in early in response to their teaching. Provide ongoing constructive feedback, as we discussed previously, and help the learner apply new ideas and skill, and they should be encouraged. They should be praising for their students when they're doing something, and they should be encouraged if they are doing any wrong thing, and they should be the error should be identified, and then the error should be corrected as well, and then they should be encouraged to practice again and again, and they should be assured that there should be no such penalty. They can have error again and again, and I'm here to correct it. So such coaching and such instructing to the students without having such that thinking of the penalty, so they will have an environment which is easy and favorable for the learning. So they should be encouraged to independent inquiry and self-study as well, because they will increase their level of thinking, they will increase their knowledge, and they may help in clearing the situation as well. Similarly, we have, this is the Burger model, which is actually we should have the um, strength of the students. We should describe the strength of the students initially. Then we discuss the weakness, the weak points they have, as well as then we also discuss how to overcome them